Thank you very much, Mr. Speaker. Mr. Speaker, earlier today I have learned even more troubling information about the government's cataract surgery plan. We have now learned that some of the successful bidders who were given multi-million-dollar contracts to perform cataract surgeries are now trying to get out of their contracts. They did not understand how much work would be required, and they do not want other surgeons using their facilities. My question is to the Minister of Health. Mr. Minister, have you got knowledge of this development? And if so, what are you going to do about it?
Mr. Speaker, I have not heard of that particular complaint or rumor or whatever it might be. What I can tell you, however, is that last week, having spoken to a number of ophthalmologists, I said I would convene a meeting so that we could get everybody into the same room and talk some of these issues through, just to take away any uncertainty that might exist and also provide some hope where it might be needed.
The honourable member.
Thank you, Mr. Speaker. My question again is to the Minister. Since some of the doctors are suggesting that Alberta Health Services has not followed a proper bid and contract awards system, will the Minister ask the Auditor General to evaluate the cataract surgery contracts to get to the bottom of this matter immediately?
The Honourable Minister.
Mr. Speaker, that's a pretty serious allegation. I don't know if it can be substantiated or not. We'll find out. But the fact is that we had a very open, accountable and transparent RFP process. That's a request for proposals. It closed on January 15th, and in addition to looking at the costs on a per procedure basis, it also included other issues, such as the speed with which these surgeries could be done, the quality assurances that could be given, the safety of the patients, the recovery times based on previous engagements, and so on. So there's a lot that went into those.
The honourable member.
Thank you again, Mr. Speaker. My final question is to the Minister of Health. Given Bill 11 requires that Alberta Health Services must disclose information on awarded contracts, will the Minister table the complete cataract surgery RFP, facility evaluation, and terms of the winning bid so members of the legislature can get to the bottom of this mess?
The honourable
question.
Mr. Speaker, whatever is in the legislation and doesn't violate the privacy laws, I'd be happy to make available at the appropriate time.
The